Okay, good afternoon, class. Welcome back once again. Today we are looking at penicillins. So, after completing this lecture, you will be able to describe the discovery and historical significance of penicillins, explain the basic structures and mechanism of action of penicillins, classify penicillins based on origin, spectrum of activity, and resistance to beta-lactamases, identify the common indications and contraindications for the use of penicillins, list the major side effects and potential drug interactions associated with penicillins, and be able to describe the mechanisms of penicillin resistance and their clinical implications. Let's look at the beta-lactam inhibitors. We said the beta-lactam antibiotics, including the penicillins, the cephalosporins, and also the monobactams and carbapenems, say a common structural feature known as the beta-lactam ring. So let's look at the structure on the right, for example. This is the structure of the penicillin, but then it has all these constituents. Okay, you see the different colors. So we have the beta-lactam or the beta-lactam ring. The ring we have here with the nitrogen group and also the amide group. Okay, so when we look at the R group, which we say is common to all penicillin, and this is what gave it the suffix of those silin, that we shall see later on, is because all of them have this chemical ring that's attached to them, an amide group. Okay, we can reflect back to our organic chemistry. These are just organic compound or biochemistry. So we have an amide group that uh, is an R group, uh, which is common to all these penicillin derivatives. Okay, so looking at the structure and composition of penicillin, we already saw it in the diagram. Said penicillins are characterized by 6-aminopenicillins acid nucleus with an R substituent, distinguishing the different penicillin family members. The composition of this side chain particularly is its accessibility to bacterial degradative enzymes like the beta-lactamases influences various aspects such as the antimicrobial spectrum and also stability in the stomach acid. Mechanism of action: penicillins hinder the final step of bacterial cell wall synthesis known as the transpeptidation or the cross-linkage, which leads to an unstable membrane and eventual cell lysis. So this is the mechanism of action of the penicillin. What do they do? They act on the cell wall of the bacteria, okay, through a process called transpeptidation, or we call it cross-linkage. Okay. After this cross-linkage, it leads to an unstable membrane in the cell wall, and eventually the cell dies by lysis. It breaks down the cell wall. Sometimes we call them cell wall inhibitors. They target the penicillin binding proteins, PBPs, enzymes vital for the cell wall formation. So they do this action by targeting this enzyme, because it is enzyme that is responsible for the formation of the cell wall of the bacteria. So once our penicillins bind to this particular enzyme, the cell wall undergoes lysis, okay, and thereby inhibiting the synthesis and inducing morphological change and even breakdown of the bacteria. Resistant mechanisms: bacteria resistant to penicillin often arises from alterations in targets protein binding sites, rendering them less susceptible to the antibiotics action. So this is also the resistant mechanism. Production of the beta-lactamases which degrade penicillins is another common mechanism of resistance. Bacterial penetration and spectrum. Penetration of penicillins through the bacterial peptidoglycan cell wall determines the antibacterial spectrum. So how easily this drug penicillin is able to penetrate through the peptidoglycan, which is the protein wall of this bacteria, is what will determine really the antibacterial spectrum of this particular drug. We have the gram-positive bacteria are generally more susceptible due to their cell wall structure, while the gram-negative bacteria have an additional barriers but can still be susceptible, especially through the porins. So this is the difference between the gram-positive and the gram-negative bacteria. Okay, the gram-negative bacteria have additional barriers. Okay, classification of penicillins. We say we can classify these penicillins by origin. We know that penicillins are natural derivatives. Okay, if we look back at the history of discovery of penicillin, they are actually described as natural origin from a penicillin, which is a mold, which is a fungal, a group of the mold penicillin. So they are produced directly from the penicillin, which is a mold. Okay, and the example is our penicillin G and even the penicillin B. Penicillin B is the oral form of the penicillin, the tablets that we take. Okay. Semi-synthetic are these are modified from natural penicillins for improved properties. For example, ampicillin and amoxicillin, these are the semi-synthetic group. Then we have the synthetic. Synthetic means entirely man-made. They are man-made with no natural counterpart. The example here is a piperacillin and picaccillin, and we shall see why we move from all these steps to this. It's just because some others are more, I mean, some others are more effective on other microorganisms than the other two. Then we can also classify it by the spectrum of activity. I think this is the most commonly used classification for people like you in the setting of in the clinical setting. So we have the narrow spectrum penicillin. These are primarily effective against gram-positive bacteria, is the penicillin G and also the penicillin B. We have the broad spectrum penicillin. We have these ones are effective against both the gram-negative and some the gram-positive and some gram-negative. Okay. Example is the ampicillin and the amoxicillin. And then we have also the anti-pseudomonas. Pseudomonas is another bacteria that always causes infects wounds and causes a lot of serious infection in wounds. This one is specifically effective against Pseudomonas aeruginosa, and the example here is our piperacillin and trichacillin. So we are going from narrow spectrum to broad spectrum and also the anti-pseudomonal group. We can also classify by resistance to the beta-lactamases. So penicillin resistant to enzymes produced by some staphylococcal bacteria. The example here is the methicillin. Okay. We also have the extended spectrum resistant to a wide range of beta-lactamases. Example is also the amoxicillin and clavulanic acid. So the amoxicillin is actually an extended spectrum antibiotic because it's a mix of amoxicillin plus the clavulanic acid, which clavulanic acid helps overcome the problem of the resistance to the beta-lactamases. So when you combine it like this, and then it becomes a synergistic effect that counters the resistance. We also look at other classifications. We have penicillinase sensitive versus penicillinase resistant. This one is based on susceptibility to specific enzymes. We also have what we call the aminopenicillin. It's a subgroup with broader spectrum activity than the natural penicillins. We have the antimicrobial combinations. Penicillins combined with other drugs to overcome resistance. Example is amoxicillin and also the clavulanic acid, clavulanate. Clinical applications, penicillins, including semi-synthetic variants like ampicillin and amoxicillin, are used to treat various bacterial infections ranging from gram-positive cocci to some gram-negative bacteria. Some penicillins like the penicillin B are more acid-resistant and are commonly administered orally. So the point here is that why we are able to take penicillin B orally is that it is well tolerated in the stomach acid. Others are degraded. That's why we don't have the oral form of them. So if you give someone a drug that is completely degraded by the stomach acid, that means nothing will affect the bloodstream, and then this drug will not be able to express its action in the body. So that's why sometimes we give some drugs orally, others are given directly IVs because of this kind of considerations. Penicillinase-resistant penicillins such as methicillin and napsylins are employed against penicillinase-producing staphylococci, including the methicillin-resistant strains like the methicillin-resistant Staphylococcus aureus. So you can read about the MRSA, which is a form of the Staph aureus is a bacteria that causes wound infection, and it's also one of those strains that are a bit resistant to some of these penicillins. But these other particular drugs, the methicillin and napsylin, will be effective for their actions. Uh, Clinical applications continue. We said extended spectrum penicillin like ampicillin and amoxicillins have broader activity. So actually, when the ampicillin and amoxicillin, we call them the extended spectrum. Okay, it's extended spectrum penicillins. This makes them suitable for a wider range of infections, but are vulnerable to the enzymatic infections, which can be countered by combining them with the beta-lactamase. So if they are alone like this, sometimes it's a bit difficult. They are not so much effective on those beta-lactamase producing bacteria. So if we are dealing with a bacteria that has this beta-lactamase enzyme, we know we are likely dealing with that. We need to combine these two drugs with carboxylic acid so that we can have the drugs like the amoxicillin. Let's look at the anti-pseudomonal penicillins. We have the carbenicillin, ticagrelin, and also piperacillin are known as the anti-pseudomonal penicillins due to their effectiveness against Pseudomonas aeruginosa. Piperacillin is particularly potent among these groups, this is more potent compared to the carbenicillin and ticagrelin. Combining ticagrelin and piperacillin with a beta-lactamase inhibitor like carbonic acid or tazobactam expands their spectrum to cover penicillinase producing bacteria. So we said by combining this, it gives an additional benefit. We look at synergistic actions with aminoglycosides. So beta-lactam antibiotics, including penicillins, have a synergistic effect with aminoglycosides. Aminoglycosides uh, is the group of the other drugs like the gentamicin. Okay. So when we combine these two, it can be synergistic, meaning producing better effects to counter the bacteria. They modify bacterial cell permeability, facilitating the entry of aminoglycosides into the cell, thereby increasing antimicrobial activity. However, this will not be mixed in the same infusion fluid due to chemical interaction. So the point here is that we are giving these two drugs to the same person to get a synergistic effect, but doesn't mean that we have to mix them in the same vial or ampule and then we start to give. No, you can give them separately through their different routes of administration, but you can give them like a treatment that is going together at the same time. Natural and acquired resistant. Natural resistant penicillin occurs in organisms lacking a peptidoglycan cell wall or with impermeable cell walls. Acquired resistance, often through plasmid transfer, is a significant clinical concern. We talked about plasmid already and how even the bacteria undergo conjugation and transfer the resistant variant from one bacteria to another. So for sure, indeed, it's a significant clinical concern linked to resistance against multiple antibiotics simultaneously. We look at the beta-lactamases. We said beta-lactamases are enzymes that hydrolyze the cyclic amide bond of the beta-lactam ring in antibiotics, rendering them inactive. They are a leading cause of penicillin resistance and can be naturally occurring or acquired through plasmid transfer. Some antibiotics resist hydrolysis by certain beta-lactamases, allowing them to remain effective. We look at clinical considerations. The stability of the beta-lactam antibiotics in a gastric acid and the sensitivity of the infection dictate the route of the administration, as I already explained earlier on, whether oral or parenteral. Ticagrelin, piperacillin, and certain combinations are administered IV or IM, while oral formulations are available for only penicillin B, amoxicillin, and also certain combinations. Default formulations, the ones we see in the vials, like for penicillin G and also the benzathine penicillin G, are given IM for slow absorption and for long low concentration in the bloodstream. So they a little bit stay longer. They have longer half lives. For example, if we take benzathine penicillin, it's really modified. It is a penicillin that has the longest half-life, where we only even give it once a week, meaning by the time you give the second dose within the week, still we have a certain good level of it in the blood stream. So it is really one of the long-acting penicillins. Absorption and distribution, penicillins are only partially observed orally, with amoxicillin being an exception. Food in the stomach can affect the absorption, especially for penicillin-resistant penicillins, which should be taken before after meals. Please take this point seriously. Sometimes we don't know which particular drug to swallow at which particular point. Here, it is very clear. Okay, uh, these drugs are partially observed orally, with amoxicillin being an exception. So, food in the stomach can affect the absorption. So, these drugs are better taken on empty stomach because otherwise food will affect its absorption. Beta-lactam antibiotics are well distributed throughout the body but may not reach certain sites effectively unless inflamed. Okay, metabolism and excretion. The beta-lactam antibiotics undergo minimal host metabolism, primarily excreted by the kidneys by the tubular secretion and glomerular filtration. Dosage adjustments are necessary for patients with compromised renal function, with some exceptions like napsilin and also diclocycline and oxacillin. Penicillins are also excreted in breast milk, so you need also to understand this. Safety and side effects of these penicillins. Penicillins are generally safe, but side effects include the hypersensitivity reaction that we earlier on talked about. Sometimes it can cause what we call pseudomembranous colitis and also acute intestinal nephritis. Hypersensitivity reactions can range from rashes to anaphylaxis, which is severe shock, with a higher incidence in patients with what we call infectious mononucleosis. So patients with this kind of disease might always be at risk of these effects of penicillins. Antibiotic-associated diarrhea may occur due to disrupted intestinal flora. So we said the intestinal flora are just there, but once we use antibiotics, they can become disrupted. Once they are disrupted, we can get diarrhea. Okay, so actually, broad spectrum antibiotics basically can cause those. High dosage of certain penicillin may also cause seizures, especially in epileptic patients. So precautions should be taken here. Still continuing with safety and side effects, we have coagulation problems and cytopenias may occur with prolonged treatment, warranting regular monitoring, especially in patients prone to bleeding or taking anticoagulants. Sodium or potassium salts or penicillins may induce toxicity with concentrations for electrolyte imbalance during treatment. Penicillin therapy and nursing consideration, we said assessment. So you have to evaluate the patient for any history of allergy before you give this person penicillin or even cephalosporin. Okay, the cephalosporin have also, we have people who are also allergic to, so we need to evaluate this history. As severe allergic reactions can occur and patients allergic to amoxicillin should also avoid all types of penicillin products. Minor laboratory results, monitor laboratory results, especially liver enzymes, and also report if there are other abnormalities. Record urine output and assess renal function, as inadequate urine output may also necessitate a change in the blood dosage. Still continuing with nursing intervention, obtain samples for laboratory records and antibiotic sensitivity testing before initiating antibiotics. This is the rule. This is supposed to be the norm. However, not the case for many practicing in Juba, except if you're working in some of those facilities with this cancer and sensitivity laboratories. Monitor for signs of infection, especially in patients receiving high doses of antibiotics for an extended period. Regularly assess patients for allergic reactions to penicillin, particularly after the first and the second dose, ranging from mild rashes to severe respiratory distress and or anaphylaxis. If referred to administer epinephrine to counteract severe allergic reactions. So what happens is that when someone goes into hypersensitivity reaction and anaphylactic shock, normally there's a slowing down in the heart rate, and we need to have epinephrine always. So before giving your penicillin, you need to make sure you have all these emergency response epinephrine so that we can have these cardiac stimulants while trying to sustain this patient with an anaphylactic shock as a result of reaction to penicillin. Still continuing with nursing considerations, we said avoid mixing aminoglycosides with high doses or extended spectrum penicillin G to prevent inactivation of the aminoglycoside. Assess for bleeding tendencies in patients receiving high doses of penicillin GS, it may decrease blood aggregation. Dilute antibiotics appropriate for IV administration according to the drug pamphlet. So always we need to really read that leaflet that comes along with these particular drugs to be able to give the best administration guidelines for this particular drug. Patient teaching instruct patients to complete the entire prescribed course of penicillin to prevent the development of antibiotic resistance. It's very important. Advise also allergic patients to wear to wear medical alert identification. Okay, here we may not have this medical alert identification, but just to inform healthcare providers or somebody at home about this particular allergy so that they can be rescued. Store medications out of reach of children in sealed fruit containers. Encourage patients to report any side effects or adverse reactions experienced during the treatment. Still with patient teaching, recommend increasing fluid intake to aid in the reducing the body temperature and also excreting the drug. Instruct patients to chew or crush chewable tablets before swallowing it if necessary. This helps to fasten the absorption in the stomach. Advise female patients of childbearing age to use additional contraception methods while taking penicillins. Diet suggests taking medication with food to minimize gastric irritation. This is a general consideration. Um, Renal function assessment is crucial for older adults with monitoring of serum blood urea nitrogen. So serum creatinine level. So we said always where persist, we are supposed to be monitoring this while we have like for all the patients that we have put them on these penicillins. I mean those who are taking some penicillin dosages can be monitored for serum blood urea nitrogen levels. Any increase in renal function may see the reduction in antibiotic dosage. So perhaps we can reduce the dose if we see impaired renal function. Additionally, potential drug interaction with penicillin, such as decreased effectiveness of oral contraceptives, will also be discussed with the patient. Let's look at your penicillin G, which is the benzyl penicillin. The antibacterial spectrum is effective against gram-positive cocci and also the bacilli. It also has action on some few gram-negative cocci. It is highly sensitive organisms, the streptococci, pneumococci, gonococci, meningococci. We already mentioned there the cocci and also the bacilli. Bacteria and trachis, Clostridia diphtheria, Clostridia, and also Listeria, and also the spirochetes. Spirochetes is like Treponema group that we talked about, Treponema pallidum, the drug, the causative organism for syphilis falls in this group of spirochetes. So all these, the category of infections that this penicillin G is effective against. We look at the penicillin G resistance. We said some organisms that produce beta lactamase are resistant to this penicillin. They cause changes in the target proteins and can lead to resistance. So we need to reinforce in this case. Pharmacokinetics of penicillin G. It is destroyed by gastric juice, and that's why we're always giving it IM or IV. Food also interferes with the absorption and the short half-life. It has a short half-life of up to 30 minutes. Can corrode the blood-brain barrier and inflammation and so excreted by the kidneys. But probenecid acid prolongs its action. Preparation and dosage of penicillin G, mainly for enteral administration, mainly. We only give IM maybe when we fail to get the IV line many times. Oral potassium penicillin G is also available. We have long-acting forms. We have the procaine penicillin and also the benzathine penicillin G that we already talked about. Procaine penicillin is given every 12 to 24 hours. Okay, and then benzathine penicillin is effective for 3 to 4 weeks. Adverse effects of penicillin, we already talked about this, hypersensitivity, okay. There can also be local pain and thrombosis at the administration site. CNS might also cause condition and convulsions, though not common. There is what we call the Jarix-Herxheimer reaction, especially in those with syphilis treatment, which might occur. might also cause anaphylaxis. Secondary to the hypersensitivity and is more familiar with especially the parenteral administration. Uses of penicillin. Continuing, we have the pneumococcal infections for pneumonia, meningitis, or osteomyelitis. Streptococcal infections like in pharyngitis and endocarditis, or even wound infections. Meningococcal infections. Staphylococcal infections like penicillin-resistant penicillins for most staphylococci. In the treatment of syphilis, we also use it in the treatment of diphtheria and antitoxin with penicillin. Uh, we use it also in the treatment of anaerobic infections like pulmonary or dental or brain abscess, and the treatment of actinomycosis. Okay, penicillin is a drug of choice. Also, in cases of tetanus and also gas gangrene, is an adjuvant value in tetanus. Other infections, we have anthrax, trench moth, rat bite fever, and also listeria. It is also effective against listeria. In prophylaxis, we use penicillin in prophylaxis in the conditions of rheumatic fever. Okay, people with rheumatic fever have to be given penicillin so that their valves are protected, their cardiac valves, the heart valves are protected. Also in gonorrhea, syphilis, and also valvular heart diseases. Disadvantages of the natural penicillins, we have the narrow spectrum of activity, especially those effective against limited types of bacteria. We looked at the narrow spectrum. And they are not effective orally. It's only, most of them are destroyed by stomach acid. It's only the penicillin B. They are susceptible to penicillinase enzymes, and this enzyme produced by bacteria inactivates penicillin. Also, we talked about the risk of hypersensitivity. It's a common cause of drug allergy. Semi-synthetic penicillin, we have acid-resistant penicillins. Example is penicillin B, the phenoxymethyl penicillin. This is the only oral form, and is used in mild streptococcal infections. Still, we look at the penicillinase-resistant penicillin. We have the methicillin, coloxacillin, and the napsillin. They are resistant to the penicillinase that is produced by those bacteria. They are less effective against the non-penicillinase-producing organisms. Uses of penicillinase-resistant penicillin is effective against penicillinase-producing streptococci. We have the methicillin-resistant strains that are treated with the vancomycin. So vancomycin is one of the most important drugs in this category of penicillin that is able to treat the methicillin resistant strains that of those particular bacteria. We have the aminopenicillin. Example is ampicillin and amoxicillin. They have wider antibacterial spectrum and they're also sensitive to beta-lactamases. Carboxypenicillin. Example is the carpenicillin and tricacillin. They are used against pseudomonas and adverse effects, can cause sodium excess, that is hypernatremia, and also bleeding. The urodofensilins, we have the adulcillin and medulcillin and piperacillin. They're effective against Pseudomonas, Klebsiella, and they have also broad antibacterial spectrum. We have the beta-lactamase inhibitors. Examples are the clavulanic acid, the sulbactam, and the tazobactam. They inhibit the beta-lactamases, enhancing penicillin efficacy. They are used in combination with the other penicillin, as we saw last time with amoxicillin, okay, so that they offer a broader spectrum to form the amoxicillin. Nursing implications, you have to conduct allergy history administration, observe patients after injection for allergic reactions, and also create awareness of cross allergies with the cephalosporin. With this, we have come to the end of this session. Thank you so much for being with me and see you in the next lecture.